Hello, my name is Morgan Little, and I'm going to be discussing the topic of opioid addiction in nurses. So I listed the learning objectives here. After viewing the presentation, the learner will be able to identify two causes of opioid addiction in nurses, describe how most states in the United States handle a nurse who is struggling with addiction, and also list one step you can take if you suspect a nurse is struggling with addiction. So unfortunately, opioid addiction among nurses is a very hot topic. It is a growing problem as there is a high prevalence of opioid addiction among nurses. It is estimated that 20% of nurses struggle with addiction, which is more than the general population. So if you're working with 10 nurses on a unit, it is suspected that 2 of them could be struggling with addiction, which is a very high number. Also, opioids seem to be the most frequently abused substance among nurses. So that 20% is not just opioids, but opioids do seem to be the number one substance that is abused by nurses. And we'll get to why that is in just a little bit. So why are nurses so addicted? Nursing is a very demanding and stressful profession, which can lead to nurses finding ways to cope, and they could cope using these medications. Nurses also have easy access to controlled medications, especially opioids. So no matter what unit you work on, you likely have a patient who's prescribed an opioid. So nurses are frequently handling these medications at work. Also, nurses have a high rate of emotional trauma and musculoskeletal injuries, which could lead to addiction, and we'll get to that a little bit later as well. So addiction in nursing. Unfortunately, addiction in nurses seems to happen in any culture, any gender, and with any educational background, although it does seem to occur more often in the younger, less experienced female nurse. It's not really clear why that is, but it can happen to any nurse in any department. So opioid prescription abuse can start very easily. So a nurse could have like a back injury, let's say, and they could be prescribed an opioid on a short-term basis, which could actually lead to them becoming dependent on the medication without them even realizing it. So opioid addiction can happen very easily. So the impact of nurses' addiction in healthcare, patient safety is at risk when an addicted nurse is practicing because their judgment is impaired, their coordination could be impaired, they could be withdrawing from the medication if they're severely addicted. So patient safety is definitely at risk because they could perform a med error, and if they're taking their patient's medications, the patient is not getting the medicine that they need. Nurses who struggle with addiction also believe they can conquer the addiction on their own, or they may be in denial that they even have a problem. Or nurses can be afraid of losing their job or their nursing license, which could prevent them from asking for help. Over 80% of states in the United States, including Pennsylvania, do have a very compassionate treatment first approach for nurses, which means that they will not fire the nurse immediately if they suspect that they are addicted or find that they're addicted to opioids or any prescription medication. They will actually treat them first and then discuss their job later on. And sometimes nurses can even return back to work after they've received treatment. So if you suspect a nurse is struggling with an opioid addiction or any addiction, you need to report your suspicions to your manager. That way the nurse will be able to receive prompt treatment and get help that they need. And like I said, most employers offer treatment programs for nurses. So if you suspect a nurse is addicted, the worst thing you can do is nothing. You need to get that person some help. In summary, nurses can become addicted to opioids due to very high stress and easy access to controlled medications. Addiction can happen to any nurse in any department, any gender, and if you suspect a nurse is addicted, you need to report it. So I did list a discussion question here. I just want to know your opinions on this issue. If a nurse undergoes treatment for opioid addiction, when should they be allowed to return back to work? I'm sure there's a lot of different opinions on this, and I'm curious to see what everyone thinks about this issue. And I did list my references here for you to view. Thank you for watching my presentation.